Hello everyone, how are you? Good afternoon to everybody who's tuning in today. Welcome again to another episode of Doctors Go Live on Columbia Asia Facebook. So anyway, today we have a topic that is very common, diabetes, but we have a specific angle. It's about obesity and diabetes. If you've not been watching what you eat, it's time to start because nothing good comes from consuming too much sugar and fats, but I'm not the expert here to be so judgy. So let's invite the medical officer of Columbia Asia Hospital, Klang, Dr. Dhiphen Maniam. Hi, doctor. How are you?
Hi, Sakina. Good. Hi, Sakina. Hello.
Happy with us.
Sakina,
Good to have you with us. Thank you so much for making time to talk to us about diabetes today.
Yes. Hi. Yes. You're welcome. Okay.
No problem. Okay, and then I understand that the angle that we're going to be talking about today, because there's just so many facets to diabetes. So, why have you chosen to talk about obesity with regards to diabetes? Yeah.
Okay. Because recently, our based on the statistic, they have an increasing amount of diabetes and the obese patients,
I
and
see. I see.
so
Okay.
so we
What
have
is the
a,
profile of an average obese person in Malaysia in terms of statistic? I understand that you've got some slides to show us.
yes.
Yeah, I mean, like, is it more women than men, or from which group is obesity most prevalent? Okay,
Yeah.
here we are. Okay,
Okay.
I'll hand it over
So
to you.
Okay, so based on the statistic, we have
Mm-hmm.
this high increasing amount of diabetes patients, and also
Mm.
the equivalent increasing is alarming with the obesity patients also lah. So the based on the statistic, every 5 adult patient is we have one adult is diagnosed as diabetes, which is about 3.9 million of people who are more than 18 years old is diagnosed as diabetes. And why I choose this obesity and overweight as overweight to talk about today, it's because it's obesity is one of the most common risk factor which is causing diabetes to our people. So
Yes.
yes, and on the 2019 National Health survey, it shows that we have 50.1 of adults were diagnosed as obesity, which is we see every 2 Malaysians we have one obesity patient, which is very alarming rate. We increasing in a very alarming rate, and it's quite warning. It's quite very lah. So and from 50.1%, we can see we have the overweight adults is 30.4, and 19.7 is an obesity patients lah. Okay, and which group is highly among? So what we can see here, based on the statistic, it shows compared to the man and women have a 54.7% of them are diagnosed as obese or overweight, and also according to the age group, we have 55 to 59 years old. They have 59 years old. They have a 60.9 prevalence. 50.9% of them having obesity lah. And if and according to this Southeast Asia, among the Southeast Asia, and Malaysia is the most, we have a high percentage, which is 15.6, and the second is Brunei, and Thailand, as I show is in my slides.
That's very, very worrying. How do we know if a person is obese or if he or she is just overweight?
Okay,
How can we
so
differentiate?
okay, obese, and can we go to the next slide? Okay, so how we measure the overweight or obese is based on our body mass index, because certain people, okay, for me, okay, I'll say, okay, 70 kilo is a normal weight for me, and for other people, we can 70 kilo, it can be overweight, and some of them 70 kilo is can be even obese. This is just an example lah. So how we calculate this body mass index we calculate based on the height and also proportion, the body proportion based on the height and also the body weight, which is we calculate our weight in kilogram and divide to the height meter square. So from there we can get these numbers, which is we can see it's less than 18.5 is underweight, 18.5 to 24.9 is normal weight, 25 to 29.9 is overweight, and 30 to 34.9 is obese, and more than 35 is extremely obese.
Okay, maybe we can just do an example of a BMI number that makes somebody obese, or really that depends on the original weight of that person lah. So
Yeah,
it's not the same for everyone, but BMI is the yardstick, right?
sorry, sorry, come again.
No, that means it's not the same for everyone.
Yeah, it's not same for everyone
Yeah.
because we only have to, because it's a proportionate based on your kilogram and also height, and a kilogram and a height, and we can only can when calculate, we can only rely on the body mass index lah. So this one will
Okay.
be same for everyone. The body mass index is the same for everyone. The range also will be same for everyone. If anyone who diagnosed more than 25 is overweight, more than 30 is obese. Whether the weight
All right.
and okay, but the weight can be different for others. Mhm.
Yeah. Okay, Dr. Dhiphen, let's go down to basics now and just take a look at what diabetes does to the human body.
Okay, sure. Okay. Actually, when we talk about diabetes, we have two types, type 1 and type 2. And mostly because of this risk factors, we get type 2 diabetes lah. And what this type 2 diabetes do to our body actually is two mechanism. Sometimes we'll have one of it, or sometimes we have both the mechanism will have it lah. Okay. So what are the mechanism? The first thing we call it is the insulin resistance, where we have when we have excessive glucose in our body, and our cell is not sensitive, and our insulin not sensitive enough to bring the glucose to our cell. Our cell need a glucose for the energy. So we'll take a sufficient glucose, and whatever is excessive glucose is still will stay in our blood, and insulin will be on the less effective. So what happened when insulin is less effective? Then that's where we have insulin the resistant, and which is on the excess glucose is not a converted lah, and will stay in our blood. And the second mechanism um, and a second mechanism is the over-exertion insulin production. Okay, these things when it happen, our every part of organ, every part of the body, we have a function for the for a function for everything. So one of the organ is a pancreas, which is functioning to produce insulin and correlate to the glucose intake. When you have excessive of glucose intake, your pancreas will be overworked. Will be producing insulin more and more to digest the glucose. And a later part, the pancreas will get fatigue, and will be weak and fatigue because of the overwork. And after that, the insulin production will be less. Even though we take a normal amount of glucose also, we won't have enough insulin produced by the pancreas, and which cause diabetes type 2. So this is what we call is pancreas fatigue, overexcitation insulin production lah. At the first overly produced, then after that it become less, and pancreas will be weak lah.
So that's about diabetes lah. And then when we go back to the subject of obesity, what are the possible ways for an obese person to lose weight? I mean, are there any treatment options today that can help and possibly maybe
Okay.
reduce of an obese person getting diabetes?
Yes, we have there is a treatment for the obesity, but it must be follow the step-by-step version lah. Where in my side, we can see the step 1, step 2, step 3, step 4, but there is no shortcut for these steps. Okay, you have to follow the step 1, step 2, these steps lah. Okay, so what are the steps? Is the first thing, the very important one is our diet. Okay, so our diet lah, we have to modify our diet. Since if we modify our diet, we can reduce, and we can avoid, we can only reduce our risk to get diabetes and also obese lah. Okay, how we reduce? We have to take the healthy food, follow healthy food, healthy diet, and drink plenty of water. Okay, second thing is a step two is exercise. Have to do regular exercise. Minimum is recommended is 3 times in a week, which is last about at least 30 one hours to 2 hours, something like that. Okay, so you have to do the regular exercise, which is reduce this weight and prevent the obese. And third step is a medication. This medication, this is not a magic cure. Okay, and some people we can only misunderstood. We can take a tablet, we can reduce weight, which is not. That's why I'm told this one I was only explaining. There's no shortcut. Okay, we have to modify our diet, we have to follow the exercise, then only is just the additional you can take the medication with a doctor supervision lah. Okay, then there is a step four for the obesity treatment, and this step is a surgical treatment. Surgical treatment, which is we do the bariatric surgery, which is a bariatric surgery to is a they say it's a hormonal surgery, like based on hormonal surgery. They will do this surgery, then after that for the help to patient to reduce their weight. But not every obese, every overweight patient is eligible to do it. We have to see the body mass index based on the body mass index. And here, I get to know if let's say the body mass index is more than 30 to 30, bit more than 30, 35 or more than 40, then we will suggest for the bariatric surgery lah, which is more than extremely obese BMI. Okay, so this is the treatment we can do.
Okay, if we are looking at this as a step by step, does that mean that an obese person, he or she needs to go through each step, or it's different for some people? That means some people can go straight to surgery because they aren't able to exercise. You know, I understand that obesity tends to occur more among ladies and who are over 50, 55. So I guess some of them at this age, some are very fit, but some are just not ready, you know, to go back into working out.
Yeah,
So,
but
yeah.
yes. All the obese and overweight patient, okay, they have to follow the step one, step two, step three, and there is you can go straight away to the surgery, which for the patient who have a BMI greater than 40. As I explained the BMI just now, is a more than 35 is already extremely obese. If the person is BMI is about a 40 or greater than 40, is obviously they're not fit for any exercise or anything, or maybe they can't modify their diet, or maybe they are with an appetite, because of the appetite reason. Okay, this surgery can be done. Consider if can be considered if the BMI only more than 40 or more than 40 lah. Okay, so this is when we can suggest for the surgery. Then after that they have to go back to the step one and start with the dieting, exercise. If not, after the surgery they can get the weight also lah. But they have to they have to back to the step one.
That's right. Yeah. So there's no shortcuts. Like just what you mentioned just now, you have to try as much as possible to follow this step now, yeah, starting with the food that you eat. Okay,
Only
that's very good advice. Sorry, only one?
Sorry, only the BMI 40 the above, they can go for surgery.
They can go straight to surgery. Okay. This surgery is not about what do you call it? Liposuction. It's not that kind of surgery. Or there's also surgery that makes your stomach smaller, stomach stapling, or something like that. That's not it.
No. Actually, it's the surgery is we call it is hormonal surgery.
Oh, this is new. This is new.
This is a hormonal surgery, bariatric surgery. So what they do is they do certain alteration in your digestive system, and one of it is they'll do is some partial gastrectomy and some gastrectomy until the certain part is it's a surgical procedure lah. They just do the alteration in your digestive system, so that it will to reduce your appetite, reduce your hunger, and which lead to then after that you start with the modified diet and will helpful to reduce weight.
Okay. Okay. Just want to clarify something that if a person obese, it may put that person at risk of getting diabetes, but it's not like a prerequisite. Like it's not like you have to be obese before you get diabetes. It can just attack anyone, right?
Yes. Okay. If you're so that I can hear interference.
Sorry.
Okay. Thanks. No, just now. Sorry, I had someone the interference. That's right. Sorry. So okay. If you ask me about diabetes can happen for anyone. There is a lot of risk factors by genetic, by food, by obese, and as type 1 since born. Okay, like that. For the pediatrician. Okay, so we have a lot of risk factors, and the most common is obese. Because why this obese can cause diabetes? Because this obese will 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 make a changes in our the mechanism of the digestion of the glucose, like insulin intake to the glucose things. Okay, then if you ask about the obesity and overweight, okay, whether obesity and overweight can lead to can lead to the diabetes. Yes, it is based on the statistics, but I'm not sure about the percentage. But it's almost on more than 50% or 60%. There's a risk to get the diabetes. I think more than 60 lah. Okay. That's
Of
more than seventy
of the
percent.
patient
Yes.
who is obese. Okay, all right. So
Mm.
let's say this person is obese and he or she does not take sugar, but that is not something that is directly what do you call it? That is directly linked to getting diabetes or not. It's not about whether a person takes sugar if you are already obese.
Yeah, if they're already obese,
Yeah.
okay, they're already obese, they can get the diabetes also, because our body need a glucose to 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 produce energy. Okay, so this is why we need a glucose, and to produce this glucose, and we have two mechanism to our body, which is one of it is we call it is a gluconeogenesis, okay, which is the body will convert non-glucose product to produce glucose, which is in obese patients, the lipid, the fat will convert to the glucose. This is why obese patients tend to get glucose, because they have a lot of fats, a lot of lipids, which is can convert to the glucose and can cause diabetes.
I
And
see. I see. Now I understand. Okay, doctor, now that we are at this stage of the discussion and we understand because it's the most common um, situation that someone can be in order for them to get diabetes, which is being obese. So how does obesity cause diabetes? I understand just now you were explaining that because there's a lot
yeah.
of layers of fat and that tends to be
Mm-hmm.
changed into glucose.
Mm-hmm.
So you
Yes,
said, am I reading it correctly?
okay.
Okay, all right,
Okay.
yeah. So
Now, okay, I'll come
maybe
back.
it's time. Okay, you can explain now about how does obesity cause diabetes? What is the link between these two?
Okay. So, okay, as I explained just now, okay, we had this one like number two mechanism to cause diabetes in a type 2 diabetes, which is insulin resistance and fatty pancreas. Okay, and also I told about we have our body, we have a physiological mechanism which is taking producing glucose from the fat tissue. Okay, when a patient have obese, so these are the things will happen. The muscle and fat cells may not use the insulin efficiently, and after that this thing will cause insulin resistance, which is your muscle, your cells not using the insulin to produce the energy. Okay, so this is a situation which is I explained earlier, which is cause insulin resistance. Then after that, the pancreas has to secrete more insulin. Your insulin is already not efficient, and you have a lot of glucose in your blood. So already insulin not efficient, so it's need more insulin to break down the glucose. So what happened when need to more insulin, your pancreas have to work more. Then the pancreas will get overworked, and after that get tired, and finally fail to secrete enough insulin. So you have a insulin resistance. To cope with that, your pancreas will increase the secretion, then overwork, then become a fatigue. Then after that you won't. After that we don't have insulin. Then after that the blood glucose will be raised, and we have diabetes type 2. This is how obese patient will have type 2 diabetes.
The relation between obesity and diabetes. Okay,
Yeah.
we'll just see if we've got any questions from members of the audience. Okay, before we wrap up, because that's basically it, would you like to add anything else regarding obesity and diabetes?
For now, this is it, but only have to do the nothing to add lah. But what I
Okay,
said,
that's the
yeah.
basic lah. Okay,
Mm.
all right. We've got some questions now, but these are actually questions to do with fasting. Since Ramadan is coming up, so these are for diabetics to take a note of. It's regarding fasting for diabetics, whether is it safe or not. Should what kind of food should they break fast with because they are diabetics? I'm sure there are certain things that don't apply to them because it's just different physiology makeup, I suppose. Okay, first of all, can diabetics fast?
Okay.
Is it something that they
So
can or cannot do?
yeah, actually, it's a very good question, Miss Akina. Okay, actually, this is a lot of patient also is wondering. Okay, doctor, I have a diabetes. Can I fasting? What I have to do, and what I have to avoid, and everything. Yes, as a diabetes patient, they can fast. They can fast, but with certain alterations, certain modification to their medication and everything. But they can fast.
I see. You were mentioning modifications on their medication, not about how they are fasting.
Okay, so it's during fasting months. Okay, during fasting month. Okay, before the fasting month, the patient will be taking their oral hypoglycemic agents, which is OHL, the anti-diabetes medicines. Okay, for example, we give dimicron. Dimicron we give in a BD dosing like 160 mg BD. Okay, for daily, morning and night. Okay, during fasting months, how we take this medication. So what we can do during the morning time, morning dose, we can cut it to half, like 160 to become 80 mg, and we fasting. Then after that, at night we can take 160 mg like a usual dose. And those who insulin, they can take like they have to reduce this to the half dose of the insulin. If let's say they're taking like a mixed start 40 mg BD like a morning and night, they can cut it to half 20 mg BD. At the same time, they have to monitor their glucose level time to time, because when we cut down and we modify the dose, okay, either they can get the hyperglycemia, the glucose can be high, especially when they break fasting, or they can get a hypoglycemia during the fasting. Yeah.
So the risk for diabetics during in fasting month, it's not so much about fasting itself, but it's actually to do a lot with the medication because they have to consume the medication, whether it's intravenous or by oral consumption throughout the day, certain times throughout the day. So this is where the modification comes from. Is that what you're saying?
Yeah, this is a modification
So it,
based on base fasting. They can fast as usual, like anyone, like a normal person. The only thing they have to this one alter the medication, lah, because we worried about they can get a complication like hypoglycemia. This is a very common case which we seeing in during a fasting month, lah. The patient get they take insulin, they take their medication, and also they fast during the day, and they get hypoglycemic. The blood glucose will come lower than a normal range, then they can get fainted. So this is hypoglycemia attack, lah. So this is the risk, and we scared off and we worried, lah. So that's why we asked to cut down, alter the dose to cut to half, and also the check the diabetic level time to time. Just monitor, self monitor at home. Okay.
Yeah. I think some people they used to think that, how, okay, I don't know what the life of the diabetic is like, but I know that some of them, they do have to inject themselves every day, the
Mm.
insulin injections. Okay.
Yeah.
And some people seem to think that it is not permissible in Ramadan, but actually that's fine. I mean, of course, this is a question of religious guidelines lah, but I mean, so
Mm.
many people are diabetics anyway, and if they have to use the intravenous means to afford their medication, so it is still, but don't take my word for it. You can check
Mhm.
the religious websites. Okay, so anyway, on an empty stomach, when it's time to break fast, what type of food or drink should diabetics consume when they're just about to break their fast? Is there anything specific, would you say, or they can just break fast like anyone else? I mean, I don't mean to sound like their
No.
special diet. Well, okay, what do you think?
Okay. 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 During the fasting month, when we break fasting,
Mm,
okay,
mm,
they can take normal diet as anyone, but if this
mm,
suggested, they can start with the dates, because dates when during the fasting months they'll especially the diabetes patient, they'll get a very weaker than the normal people, because they are already insulin, they're already taking insulin, they're already taking the tablet, diabetic tablets, and they try their hard to the fasting. Then after that, after the completion of the fasting, when a break fasting, they feel very lethargic, very weak and everything. So these dates, what will cause is high content of glucose, and also will be only to energize them. So this is just on the suggestion. They can take dates as a just for startup for the breakfasting as a date to energize them, to boost the energy. Then after that they can take the normal diets, no problem, and should avoid the sweetened waters. Sweetened water which is on the high content of glucose, like carbonate drinks and sweetened water and something like that.
Salty stuff. Because usually when people break fast, they seem to think that they want to go for, like the plain water is a bit too unsuitable. It seems because you've been breaking fast the whole day, so they want to treat themselves, get some
Yeah.
air sirap bandung, or air sirap selasi or whatever. But okay,
Okay.
of course,
Okay.
as a diabetic, this is not recommended. Yeah.
As a not recommended, but it's not recommended. Yes, yes.
Okay, all right. But dates, that my funny you should mention that, because that's actually the recommendation that everyone, whether you're diabetic or not, is recommended to break their fast with date, because
Yeah.
it gives a lot of energy. Okay, so all right, so we've clarified that. Thank you so much, Dr. Dhiphen. Okay, now let's
Thank
take a look at questions from our audience. Miss SP Yan has the first question. Hi, doctor. May I know if the person's BMI is normal? Will he or she also have the risk of getting diabetes? What do you
Okay.
think?
Okay. As a person, BMI is normal, whether they
Yeah.
can get a risk of getting diabetes. Okay, as I as I explained just now, obese and overweight is one of the risk factor to get diabetes, but it's not only risk factors. Beside the obese, they can have other risk factors as well.
Yeah. Okay. All right. Another question by Miss Gloria Jackson. Hi, doctor. Can someone cure from diabetes once he or she has been diagnosed with diabetes? I mean, even when he or she has changed his or her lifestyle.
Okay.
It's
So
irreversible, right? When you get diabetes, means you have diabetes for life.
actually, when we diagnose as a diabetes, okay, it's irreversible, which is it's a irreversible, because we can give the treatment to control the diabetes, but we cannot 100% cure like that. It's like we shouldn't take medication, shouldn't take the insulin intake and everything. They should take medication, they should follow the medication and the insulins, uh, continue the medication, because we cannot stop, because we is irreversible lah. But only thing, we can reduce the doses based on our compliance, based on our lifestyle modifications, and based on our diet, and our glucose is controlled very well, and throughout the days, years. Then after that, they can only reduce the dose lah. Dose, but you have to take the medication. And if you want to stop the if they need to take medication and have a regular follow up with the doctors lah.
Okay. Yeah. Yeah, I suppose that would be it today. I'm just going to go back to what Miss Gloria Jackson mentioned. So you're saying that once you get diabetes, you live with it, you manage it. It's not something that you can undo, even though you change your lifestyle, you're eating better, you're exercising, but that's just a matter of adjusting medication
Yeah,
according to what your doctor prescribed lah. But it's not
yeah.
to say that you can just walk free and not have to makan any ubat at all.
No, it's irreversible, but you have to control it. Yes, it's an irreversible, so we can just give a treatment to do the stabilize and control the diabetes. Even if we take the medication, let's say our blood glucose level is already reduced and maintained to a normal amount. That normal amount is maintained by your medication, not by lifestyle or food. Unless we start did the lifestyle changes and modify our diet, then we can monitor the blood glucose. Then our doses of medication we can cut down. Usually we can realize our doses of medication is getting increased because of our diabetes is not controlled. So that's the first thing I have to control, and it's lifestyle changes and everything. We cannot cure if the mean of cure, so that we don't take the medication at all. We won't get the diabetes after this. Okay, the diabetes will be there, but it can be controlled, and we just maintain.
Okay, doctor. On the side, sometimes we hear about diabetes all the time. In fact, I think in every November, it's the World Diabetes Day. So there's a lot of diabetes awareness and campaigns going around. But even so, some Malaysians sound like they may be kind of immune, to news about diabetes, and they don't see the danger unless it happens to them. So they keep on eating the way they do, a lot of trans fats and sugar and whatnot, because unfortunately that's how Malaysians eat lah. I mean, the ones who go like happy go lucky and
Yeah.
not really not really looking at healthy lifestyle. To them it's just normal. Roti canai, nasi lemak, and teh tarik and all these things. Okay, but from your personal point of view, if you've got something to say to our audience today, okay, we've wrapped up all the questions already, but an advice lah, about the danger of diabetes, so that people actually know that we are talking about something that's very serious here. It's not just a campaign. It's not just, something that affects other people but will never happen to you. So, okay. What would you say, doctor? I hope you understand what I mean. I'm just trying
Yeah,
to drive the message home.
Yeah, like a take home messages lah.
Yes, take home messages to make sure that they really understand that this is something they need to take serious note of.
For me, is the message for me. I will say this. First thing we have to realize the diabetes is a silent killer. I will say this a silent killer, because you won't know your glucose intake is killing you and harming you inside the body until it get worse. Once it get worse, once you have a hyperglycemic attack, like diabetic ketoacidosis, all the complication, everything, then only we will notice. Until then, we won't notice we have advanced diabetes. We go admitted in hospital, then we check the DXT level will be high, 15, 20. So it won't shows any early symptoms. And this diabetes, it's a chronic process. It won't happen within 1 or 2 days. So it will happen is a chronic process. So how we can manage it, how we can prevent it, is a base. It's just an awareness about our health. Keep doing regular health screening, check for the DXT level, control our cholesterol levels, regular exercise, and back to again our diet. I understand our country, we have a lot of this delicious food, even nasi lemak, roti canai, teh tarik. Okay, so everyone liked it. Okay, even I also liked it, but we have to take it this limited amount, and I have to control, and shouldn't take lot. So just diet changes. Okay,
Yeah.
this is yeah. So okay,
Okay,
this is
thank you.
yeah. Thank you.
No, go ahead, go ahead. Sorry, you were going to say something just now
Okay,
before I
yeah,
interrupted
this
you.
is my diabetes, diabetes. So this is my diabetes, and it's a silent killer. And second thing I'll say is king of the diseases, lah. Okay, most common one is the heart attack, okay, heart problems, and diabetic ulcers, diabetic neuropathy, diabetic cataracts, retinopathy, the diabetic kidney failure, diabetic nephropathy. And so this is why I will say is diabetic can be a silent killer, and also it's the king of the diseases, because if will shut down, he will, because of the chronic diabetes which is uncontrolled, will cause a lot of complication to our body, and will be very dangerous. So this is my take
Because
on that.
Right. Thank you so much, Dr. Dhiphen. Because you were saying that it's a silent killer. So, of course, when we're talking about silent killers, health screening is one of the ways for us to detect. So, how often would you suggest someone to go for health screenings to check on blood sugar and all these things?
Okay, my suggestion for those who normal person without any complication, I recommend they can take once in a year annual health screening, at least once in a year, so that we can know our whether we can do our blood screening tests, and we just check ourselves whether it's a cholesterol all in under control and everything. This is the health screening, lah. Okay, and how about those who have a comorbids like hypertension and what about diabetes and everything, is based on their regular follow up and under the doctor advice, lah. So a minimum it needed about three two two to three times in a year, which is every 6 months or every 4 months. And also even very frequent is based on their comorbids control and their level, and also the doctor suggestion. For the normal adult, I will suggest at least must have an annual screening once in a year.
At the very least, yeah? Okay. All right, thank you so much. So that was Dr. Dhiphen Maniam, the medical officer of Columbia Asia Hospital Klang, talking about obesity and diabetes, and also about fasting and diabetes, and of course about health screenings as well, because as Dr. Dhiphen mentioned, diabetes is a silent killer, so you must take it seriously.
Yes.
Okay, thank you again, Dr. Dhiphen, and thank you everyone for tuning in. We'll see you again in another episode of Dr. School Life. Bye.
Okay. Thank you.